Almost 100,000 people of color prematurely die each year who would not die if there were no racial disparities in health.
My name is Dr. Linda Maldonado, and I am an assistant professor of nursing here in the College of Nursing. I am charged with teaching in the classroom, teaching in clinical, which means in a hospital setting or in a setting where there are patients or a community of people that need to be cared for. As a historian, my lens is very wide. I look at context, I look at, factors in a person's life, not just the person caring for themselves, but what kind of environment they live in. What are the sociopolitical influences that affect their image of self?
Health Improvement Partnership Cuyahoga, otherwise known as HIP Cuyahoga, understands that neighborhoods and communities are not all created equal, and some people are born and live in places where it is difficult to grow up healthy. The conditions in which people live and the opportunities they have form the foundation for health, and without them, people are more likely to live shorter and sicker lives.
Depending on where people live, work, and play, and the opportunities they have to be healthy, it can impact not only their health, but how long they live. And so we really embraced that information and data, and we had a very substantial difference in life expectancy in our region when we initially did that assessment.
Martha Halco is the Deputy Director of Prevention and Wellness on the Cuyahoga County Board of Health, located in Ohio.
Sometimes people can be very mistrusting of the medical world because of history. As we know, we've not treated people kindly. We've taken advantage of people. When we talk about health equity, they're in an environment many times that does not allow them to, or that they don't see a way to embrace health, or they may not feel it's possible for them for whatever reason, be it fear of neighborhood crime, be it depression and anxiety, being it not having anybody to talk to. That we need to be wide awake and make sure that when we are caring for our patients that we're doing so ethically, that we're doing so legally, within the scope of our profession. We're making sure others are practicing within the scope of their profession, right? To keep our patients safe. Because history is a good teacher. We need to understand our patients and where they come from. And I challenge my students, don't just look at your patient as that human body that delivered a baby. And patient A needs the same as patient B. No, patient A may come from an area that's very high violence, high homicide rate. Patient B might come from an area of town that it's a higher socioeconomic status, it's lower, it's a very safe neighborhood. Their perspectives are not going to be the same. Talk to them and you ask them and you get to know them culturally, and what do they like done, what do they not like done. And that's not going to look the same as that Latino 2 doors down in your hospital, 2 rooms away. So if we don't do that, then we are missing the mark.
We understand that, in essence, the reason we have differences in opportunities is due to the systems and structures and policies historically that created, sort of the segregated environment that we have in our county, which in turn has also resulted in those areas being the areas that have the least amount of resources and the least amount of opportunity to be healthy. So we're trying to address that issue broadly. How do we begin to ensure that policy decisions that are made, or systems in our community like education, transportation, food access, physical activity, etc., that these systems provide opportunities for everybody?
We need to understand a lot of our health disparities are historic, and they're rooted in issues of racism and neighborhood violence, and in not having access to adequate resources so that you and I can access a doctor equally. If I've got to take 3 buses and go through this bad neighborhood, and we need to work that way. It's going to take a lot of collaboration. It's going to take thinking outside the box. It's an African-American woman who was in labor, and We had a policy, and it's still a policy in every hospital, where the physician who's caring for the patient, the obstetrician, has to be in the hospital. We call that in-house, when the patient's getting an epidural, which is for pain relief. And the physician refused to come in, and so she couldn't get her epidural. There was another physician who, the patient was 4 centimeters. You have to be 10 centimeters to start pushing. He gave her an hour, and because he had a dinner date in the city, in New York, he called for a C-section. And I will never forget that. She was Latina, and I felt so powerless. You know, I was still developing as a professional. Well, that really hurt. And I think at that point, or around that point, and certainly moving forward, I realized that if I don't speak up in times like this, then I'm just as guilty as the person. We have all of these amazing hospitals, inordinate amounts of money being spent on healthcare in this country. These are our citizens. You know, a healthy country health is so important, and it's of all community members. It's of all citizens of this country, regardless of race, class, ethnicity.